We're going to discuss just a few things associated with the panchakarma therapies that are very, very important that you can do on a daily basis yourself, and also bring it into part of the Ayurvedic healing course so that you can start working with the greater sphere of Ayurvedic tools available to you. Now, one of the things that's very important to use and to know about is this little device here. Now, it looks like a kind of a lamp or a burner, or like the bottom part of Aladdin's lamp, but it's actually called a Gokarna yantra. Gokarna meaning cow's ear because it is shaped like a cow's ear, and yantra meaning a device or something that's used, a mechanism. This is used for pouring oil into the ears, as in the case of Karna Purana, which is the Ayurvedic practice where various medicated oils, just including normal sesame oil, can be used and heated up and then poured into this device here, and then when the patient is lying down it can be poured into the ear cavity and then blocked up with some cotton wool or gauze. And then of course the other ear can be done as well. This is retained for about 15 minutes and it's much easier to use something like this, one of these devices, and it looks much nicer as well, Gokarna Yantra, than it is to perhaps just use a normal dropper. The Gokarna Yantra is also used for eye treatments such as in Netra Tarpana. This is where ghee is poured into the eyes itself, and we can use this for cataracts, eye diseases, or weary or tired eyes, pain in the eyes, those sorts of things. So a dough ring is made around each eye itself and then is placed around the eye with some water to make sure that the oil doesn't come out or the ghee doesn't come out. And then just a small bit of ghee is placed in here, slightly warmed, and then it is poured just in the corner of the eye, just here, with the eyes shut. And then when the dough rings have been reasonably filled, the patient is asked to open their eyes and then blink repetitively so that the ghee does go in their eyes and nourish it. This can also be used when we make a decoction of Triphala churna or Triphala powder and some water as well. Just a small bit can be used and then strained, and then we can use it in this here in regards to other disorders, especially if we're again having eye inflammation, eye styes, we feel that we've got something in the eye or mucus in the eye. This can be used by the eyes being closed and then pouring the small bit of Triphala decoction just in the corner of the eye here, as in the case of Seka and Asjotana, which are two other netra kriyas or eye therapies or practices that are done in Ayurvedic medicine. One can also just simply make a small Triphala decoction and strain it and use it for their eyes as well. And this is also good if you're having allergies, dust allergies, those sorts of things. Another thing that you'll read about in the course as well is Marma Gudika. Marma Gudika are special Marma tablets. Marmas are the 107 vital areas or spots in yoga and Ayurveda throughout the body. So at each one of these areas, or if there is pain or swelling or redness at any of these sites or elsewhere, such as knee joints or ankles, etc., you can use these tablets or gudikas. So you can have a look at these tablets here. These tablets are very, very tiny, and as you can see here, they're quite hard. So they do need to be broken up, and then once you break these tablets up in a mortar and crush them into a powder, they can be added with aloe vera juice or gel, or egg white can be added to them as well. And then a paste is made and then applied to the area. So for example, if a person has swelling on an elbow joint, then it can be used there. Slightly massage the area with warm sesame oil, or with Muravena Taila, as you'll read about in the course as well, a very useful oil for pain and swelling. And then you can just apply this paste on the area and leave it to set for about 45 minutes, and then it can be washed off. This is very, very good in all cases of pain and swelling, for arthritic pain as well, rheumatic pain. It's very, very good. Another thing you can use for the nose that you'll read about is anu taila. Anu taila is a special oil used for ENT disorders, and it is administered through the nose itself. And often they come in small bottles like this one here, with a little dropper, so you can just take this off. Now the oil needs to be slightly warmed, and this can be done quite easily just by submerging this in some hot water itself until it's warm or lukewarm. Or you can alternatively use the Gokarna yantra and just pour some of it in here, and then just put this in a warm vessel, just slightly submerge it around here so the water doesn't get inside, and warm it up. Not too hot, just lukewarm. And then 2 drops for each nostril can be used, just 1 into each nostril and sniffed up until it is felt at the back of the throat and some burning, and then the other nostril. This can be done on a daily basis, as I've said, 2 drops in each nostril itself, and it helps in all sorts of disorders such as premature graying of the hair, falling of the hair, as well as helps in hearing, helps in toothaches, earache, and also sinus allergies as well, especially as we're getting in spring seasons where there's a lot of hay fever and allergies that come up, is also in the summertime. So it's very good for all those sorts of disorders, and also helps clear the nose and the throat for practices such as pranayama or breathing techniques. Relating to the nose, there is another practice that you'll read about called dhumapana. Dhumapana is medicated smoking, so it's in taking the smoke through the nose as well, and it helps to dry out, especially if we're having a lot of running nose, those sorts of things like that. It's very good to dry it out, and it is done often after nasya treatment with things like the anu taila also. So this here is used for dhumapana. This is a dhumapana yantra. So what is used here is just this small medicated stick here that's got guglu or resin in it, as well as other herbs, and it is made into this small special tablet here, and this is lit just with a match, and then it is put inside the yantra itself. And then with the patient, you just hold it under their nose, and they just breathe in through, close their eyes and breathe in through one nostril, and then out through the mouth. This can be repeated about 3 to 5 times per nostril. It's also very, very good if there's asthma or anything like that as well, and it also helps in a lot of ENT disorders at the same time, especially sinusitis. Anu taila, of course, can also be used for sinusitis as well. So these are just a few things that you can use in Ayurvedic medicine, and these are discussed in the course, but this just gives you a bit of an overview about some of those practices that you can do on a daily basis as well, and incorporate into your own daily practice. Namaste.